Even as social distancing becomes the new norm, there's one outing that many people just can't avoid, and that is a trip to the grocery store. Here in the mountains, people can now expect changes the next time they go shopping. News 13's Stephanie Santostasi joins us live from the Ingles on Long Shoals Road. And Stephanie, the store's installing plexiglass at the registers.
Yes, within the next 2 weeks, all stores should have them up. It's a way to protect both employees and customers during this time. The next time you go grocery shopping at Ingles, things may look a little different inside. This picture from a viewer shows signs on the shelves and arrows on the ground indicating one-way aisles. According to Ingles CFO Ron Freeman, this started at some stores last week. All stores will be doing it soon. Additionally, tape's being put 8 feet apart on the ground in checkout lanes. It's a way for people to stay separated while waiting in line. Customers who bring in reusable bags will also be asked to bag their own groceries.
Supporting our community has been a number one priority for us.
Over at Walmart, similar measures are being put in place. The store's adjusted operating hours to give employees more time to restock and clean.
Closing overnights has helped the store tremendously.
This weekend, Walmart also started limiting the number of shoppers. No more than 5 customers will be allowed in for every 1,000 square feet. That's roughly 20% of a store's capacity.
This is even more, again, giving us a chance, to prove that, we are here for them.
Additionally, Walmart stores will soon start using these 2-gallon sprayer kits to sanitize carts, which they already sell in stores. At Publix, employees there have the option of wearing masks and gloves. The stores also installed plexiglass shields at registers, customer service desks, and pharmacies. Additionally, there's signs up reminding shoppers of staying 6 feet apart at all times.
Many individuals or families who've lost employment are looking for additional benefits to get by. A viewer asked, has the federal government or state government relaxed restrictions or work requirements for families needing to apply for SNAP benefits, food stamps, EBT? Well, the answer is food and nutrition services have been expanded. For March and April, all families receiving FNS will get the maximum amount for their household size. It's automatic. The increases started April 1st and will appear again April 22nd. Pisgah Legal Services is encouraging families who may be in need but don't receive benefits to apply.
What I would encourage people to do is to apply for benefits if they're not currently receiving them. This is something that might really, help provide some extra support.
The certifications have been extended for those who've qualified for both 6 and 12-month periods. Work requirement for able-bodied adults who don't have dependents are also temporarily suspended. You can apply online and no longer need to be in person for an interview to be approved. We've put that link at WLOS.com. Questions are coming in about travel restrictions across state lines. One viewer asked, what is the status for crossing state lines for those who live close to a state line and need supplies? Before traveling to another state, you should be familiar with that state's rules on travel during the pandemic and be aware that there might be restrictions at the county level too. Across the line in Tennessee, a statewide stay-at-home order is in place, but South Carolina currently does not have such an order. We reached out to officials with the North Carolina Highway Patrol, and they say they stand behind Governor Roy Cooper's executive order. North Carolina's stay-at-home order says, in part, that individuals can leave their homes for essential activities in cases such as to obtain necessary services or supplies for themselves and their family or household members. The COVID-19 pandemic has changed everyone's lives in so many ways. The people who respond to calls for help are no exception. News 13's Frank Crocker has that story.
911, what's the address to your emergency?
123 Woodland Drive.
And what's going on?
That's what you hear in Henderson County, plain and simple. If it's medical assistance, especially these days, it ups the ante.
That is critical. The first thing that happens is when someone calls 911 is they start triaging that call.
Triage by telephone, including questions any medical professional would ask. trying for an initial diagnosis.
They're going to ask these folks specifically about a fever, about a dry cough, if anybody in their household is experiencing some of these same symptoms.
Henderson County Sheriff Lowell Griffin is among those who sees emergency dispatchers as the first of the first responders, getting people on the street the first thing they need.
A picture of the environment that they're rolling into, but they take that a step further by trying to get some specific information as it relates to this pandemic.
So you're going to see paramedics and EMTs wearing this type of personal protective equipment on every call.
Henderson County Emergency Services Director Jimmy Brissy demonstrates some of the essentials, depending upon the severity of the situation, what they know about it from 911. It ranges from simple mask and eye protection to powered air purifying gear. There's one critical way of learning what they might need.
It's very much important on the public to be honest and tell those telecommunicators what they're seeing from a symptom standpoint, how they're feeling, so we can make sure we're making the best preparations we can.
Now, just for the survival of our first responders, it's more critical than it has ever been.